Research Group says the Delta variant of COVID-19 may be driving the surge in cases in the National Capital Region. Joining us now to tell us more is OCTA Research Fellow Guido David. Good morning, Professor. Welcome back to New Day.
Hi, good morning, Mai, and good morning to our viewers.
Professor, just last Monday, you said on the show that we're seeing the initial phases of the Delta variant surge in the NCR, and reproduction rate is at 1.33. Did this change in the past 2 days, and how alarming is this?
Well, today, as of today, the reproduction numbers, it is still at 1.33. But it is concerning because the increase in reproduction number, although it may have stalled today, I mean, it has not yet decreased. And it's alarming because it's following a similar pattern that we saw twice before, and that was earlier this year in February, and then last year, of course, around July. In fact, it was almost around this time last year when we had to implement a timeout MECQ, or timeout lockdown, for the healthcare workers. So this is concerning, and if history says that if we don't do anything, the cases may still continue to rise. And eventually, when it becomes exponential, it will be difficult to manage. This is what we saw last March. The difference is that last July of last year, it was still at less than 2,000 cases when we had the lockdown. And so it only required us 2 weeks of an MECQ to contain the cases. But earlier this year, we waited until we were at around 4,000 cases. And then it was a lot more difficult to contain it. So we had to be in a lockdown for about 2 months. So
Yes.
that's the main difference.
Professor, the health department says there is no definitive evidence of a surge, and they're also appealing to independent experts such as your group to be more careful in making pronouncements, as this may cause more panic and fear. I'd like to get your reaction to this.
Well, Mai, we are very careful in our pronouncements. And when we see these patterns, these increases in the reproduction number, this is unmistakable. And if we look at the case of Cebu City, last week we could say that, there's still, the reproduction number is still manageable. Last week it was maybe about, 1.5 or 1.6. And now it's already at around 2. And they're averaging more than 200 cases now per day. So although of course Cebu City is a different kind of setup, so it's probably easier for them to manage the pandemic even when their cases reach that high. I mean, relative to their population, it's already high, but relative to the NCR has a lot more people. It's a lot more dense, and it's a lot more difficult to manage, an exponential increase in cases. So what we're saying is that, yes, right now, perhaps the surge is still in its early stages and it can still be managed. But if we wait too long, next week, it may not be the same case anymore. And, a 1 week timeout now compared to maybe 3 weeks or 4 weeks timeout later, I mean, that's a big difference in terms of, the impact on the economy and on livelihood.
So tell us more about what you are suggesting, the go early, go hard strategy. Tell us more about that.
Yes, well, the strategy is that just like last year from July to August, if we have a lockdown now, while the cases are still beyond manageable, then we can contain this virus effectively and immediately. And then we won't have to worry about it anymore because our vaccinations are still scaling up or still expanding. And right now we don't see another credible threat all over the world. I mean, yes.
Professor, but obviously the tighter protocols must be accompanied by expanded testing and tracing. Now, where do we stand in this?
Well, I can't comment too much on the contact tracing because this is something that local governments have access to. Well, we do have access to some local governments, but the contact tracing may be different for some. What we do know is that they have expanded contact tracing. Testing, well, I believe they have expanded it by adding testing laboratories, but what we're seeing right now is that the number of tests hasn't really increased that much. And my belief is that in speaking with some local governments, they're now using more antigen testing in place of PCR testing.
Mm-hmm. Professor, finally, in terms of your projections, the daily active cases, what are you seeing by August or September?
Well, actually, what we're seeing right now is that, I mean, right now we're averaging maybe around 1,000 cases per day, but by mid-August, by August 10, and that's just, maybe about 2 weeks away, we could be averaging about 2,000 cases already. We could be having 2,000 cases per day in the NCR, and that's, of course, a concern because if we reach 2,000 cases, we'll be reaching the surge capacity, close to the surge capacity of the region at around 2,000 cases. So that means, at that point, it will start becoming more exponential because it will have increased, exceeded the surge capacities. And as we also mentioned, we have to take this threat seriously because we do know there's the Delta variant. Based on sampling, we think it's about 7% of the total cases would be attributed to the Delta variant, just based on sampling.
Mm-hmm. It certainly is concerning. You stay safe, Professor, and thank you again, OCTA Research Fellow, Professor Guido David.